Since the start of the pandemic so many months ago, an increasing number of Canadians have become armchair epidemiologists and public health experts, pontificating about the underlying assumptions of the pandemic and the data that drives decisions. It's important to acknowledge and properly consider expert advice, but critically thinking through decisions that affect your life directly is one of the byproducts of this pandemic that's actually very positive. When I look back at the most impactful moments of my own advocacy, asking questions and challenging assumptions has been central to making a difference. I regularly ask myself the question: does what I believe and the assumptions I accept move forward the change I want to see in the world? In this Walrus Talk, I'd like you to critically consider the following statement: austerity will lead us to healthcare sustainability. For those unfamiliar with the term, austerity is a strict economic ideology that governments impose to control growing public debt, defined by increased frugality. Sustainability is defined as the ability to be at a system level that can be maintained at a certain rate. Taken together, austerity leading to health system sustainability means that an ideology of frugality will lead to being able to maintain a system at its current rate and level. The arguments behind this statement are well worn. Compensation has outpaced relative increases in other sectors. The wages of paying healthcare workers makes up the majority of healthcare system costs, and this is an inherently bad thing. If we do not decrease public spending on healthcare, it will become unsustainable, and this will be out of the government's control. But let's critically look at each one of these statements. First, has compensation really outpaced relative increases in other sectors? When looking at the pace of compensation, the reality is that healthcare spending has not been rising at a continuous level. From 1976 to 1991, there was a steady increase in government investment in healthcare. From 1992 to 1996, governments cut back spending to balance budgets. And from 1997 to 2008, we returned to investment. Since 2008, austerity has returned, and cost-cutting continues to accelerate in recent years. Secondly, are the wages of paying healthcare workers making up the majority of healthcare system costs, and is this inherently a bad thing? Having staff being paid to provide care would actually make a lot of sense when considering proportionality in healthcare spending. Wouldn't you want the major cost driver to healthcare be providers interacting with patients providing care? Third, if we do not decrease public spending on healthcare, it will be unsustainable, and will this really be out of the government's control? No cost in government ever goes out of control because government spending is a choice. When the government can't control, however, is the political consequences of these choices. Finally, back to the original premise: has austerity made the system more sustainable? Consider what we've discovered in the midst of this pandemic. Our healthcare system is on the edge of unsustainability. The primary reason behind lockdowns was overwhelming public healthcare system concerns. The thresholds for lockdowns have in large part been related to hospital admission rates and ICU admission rates. It's clear when you look at small differences and how they can have catastrophic impacts. It's a fact that we have very little resilience within the healthcare system to deal with increased demand. Also consider what we've learned about healthcare workers in the midst of this pandemic. Pre-existing issues have accelerated and become magnified. Burnout is out of control among healthcare workers. Each of us has been sacrificing ourselves, relationships, livelihoods, health, and wellness to make sure patients don't fall into the cracks we know are there. I've seen many colleagues walk away from careers that require decades of investment. Working environments are simply untenable in many parts of the country, and healthcare workers are leaving to pursue other jobs. Has austerity made the healthcare system more sustainable? I think the answer to this is multi-layered and is different when talking about what government, providers, patients, and their families want. But the premise that an ideology of frugality will maintain the health system at a level where we can maintain services is not only flawed, it's untrue. But that doesn't necessarily mean that we need to endlessly spend either. It means we need to make better choices. I hope you personally take a moment to unpack this question yourself. Just like decisions around the pandemic that have impacted your life directly, continuing down the path of austerity in hopes of sustainability will have impact on your life for years to come.